let's explore the posterior muscles of the shoulder girdle, the muscles that elevate, retract, and rotate the scapula to support efficient arm movement. We'll start with the trapezius, which has three functional fiber directions: descending, transverse, and ascending. The descending fibers originate from the occipital bone and the cervical spinous processes and insert onto the lateral clavicle and acromion. Their primary role is to elevate the scapula, and they also assist with retraction and upward rotation, especially during overhead movements. They have an important additional function. They can laterally flex the neck on the same side and rotate it to the opposite side. Next are the transverse fibers, which originate from the upper thoracic spinous processes and insert into the scapular spine. Their major job is retraction of the scapula, pulling it directly toward the midline. Then we have the ascending fibers, originating from the lower thoracic spinous processes and inserting along the medial scapular spine. These fibers help with depression, retraction, and importantly, upward rotation of the scapula, working together with the descending fibers during arm elevation. Now let's look at the rhomboids, minor and major, as a functional pair. Both originate from the spinous processes of the spine and insert along the medial border of the scapula, but their positions differ slightly. The rhomboid minor originates from the lower cervical spinous processes and inserts above the scapular spine. The rhomboid major originates from the upper thoracic spinous processes and inserts below the scapular spine. Think of it as minor above the spine, major below the spine. Functionally, both retract and elevate the scapula, and both contribute to downward rotation. The major, being larger, generate more force, while the minor assists and stabilizes the superior medial border. Finally, the levator scapulae originates from the upper cervical transverse processes and inserts on the superior angle of the scapula. As its name suggests, its primary role is to elevate the scapula, and it also assists in downward rotation. Together, these posterior shoulder girdle muscles coordinate elevation, depression, retraction, and rotation, forming the stable yet dynamic base that allows powerful and precise upper limb movement.